Hi, this is Tony with StuffSeniorsNeed.com, and I am coming to you today with an important video regarding Medicare Supplement Insurance Plans. They're also known as Medigap plans. The purpose of them is that this supplement plan ends up paying the 20% of the bill of your expenses that Medicare Part B doesn't cover. Okay, it's a separate insurance policy, and you have a separate set of coverages and a separate premium outside of what you pay for Medicare Part A and for Part B. So what I'm going to do is I'm going to walk you through the basics on the program and show you exactly how it works, and then how to pick the best one for you. First, when you sign up for Original Medicare, if you're signing up through the government, okay, you're enrolling in Medicare Part A. That covers hospital bills for a long-term stay in a hospital, and it covers Medicare Part B. Now, Medicare Part B covers your doctor's visits and your durable medical equipment, everything from a prosthetic limb to walkers to wheelchairs, things like that. Currently, as I make this in 2012, the premium is $99.90 a month, but that premium changes year to year. Okay? Now, Part B covers 80% of that bill, like I said, but the remaining 20% is your responsibility. And that's where this Medicare Supplement Insurance Plan comes in. It's also called a Medigap plan. So if you hear the two terms thrown out there, it's the same exact thing. All right? This supplement plan or Medigap plan, okay, will pay the 20% of the doctor bill that is not covered by Medicare. All right, that's the purpose of it. So now that you understand what it is, you have to understand how to pick the right one for you. And in order to do that, there is a very important principle I need to get across to you. When you're dealing with a Medigap plan or a supplement plan, like I said, they can be used interchangeably, those terms, they mean the same thing. You have to understand that the companies that sell them have to agree to sell a standardized policy. Okay? Now, for them to get approved through Medicare, you're buying this plan, you're buying it from an outside insurance company. That could be an AARP, a Humana, an Aetna, United Healthcare, any of those companies. If a company is approved by Medicare to sell these policies, they have to sell a standardized plan, meaning the plan that any one of these companies sells is identical in the terms, the conditions, and the benefits it offers. Okay? The Plan A from AARP is the exact same policy as Plan A from Humana. All right, there is no difference. Now, the salesperson may try and convince you that there's a difference. They may try and sweet talk this, but that is not the case. They are identical. However, even though the policies are identical, okay, each company is allowed to have its own underwriting guidelines, and that means that the premium could vary from policy to policy and company to company. So, make this real simple. Once you make the decision which plan that you want in terms of this supplement plan, whether you want Plan A or Plan B, once you pick that one, all you have to do is find the cheapest plan, the company that offers the cheapest plan, because they are all identical. So now that we've gotten through that, I want to talk to you about picking the right supplement. First of all, understand what a supplement plan does not cover. Number one, it does not cover long-term care in a nursing home. All right, it does not cover vision or dental care, hearing aids, or eyeglasses. All right, it will not cover those. Now, here's what it will cover. Right here. Take a look at this chart. I'm going to be referring back to it. Okay, but this chart actually comes out of the 2012 Medicare and You book that the government puts out. Okay, so which one should you be choosing? It really is dependent upon your financial situation. Okay, as an example, if you're in decent health and you have limited resources, Plan A is the cheapest and the most economical. Therefore, that's the one that you should be going. You might want to consider at least. Now, the most comprehensive coverage is a part of Plan F. Okay, but let me just refer back here and I'm going to show you what I mean. Okay, Plan A, and again, you see how it has Medigap here? It's the same thing whether we're talking about a supplement plan or a Medigap plan. Plan A has the most limited coverage. Okay, Plan F is the most extensive of coverage. So obviously Plan F is going to cost more than Plan A. Some things to note here when I'm looking at this. You have foreign emergency travel expenses, which is a part of Plans C, D, F, and G. If you're not going to be traveling overseas, there's no reason to have that as a benefit. Okay? So just something to keep in mind. One other thing I do want to point out to you. Okay, because this is definitely confusing, all right, to pick the right one for you, because you could get into a case of, analysis paralysis. You just don't know which one to do. Here's one tip that may help you. I want you to call your local office of the aging. Now, in your area, it may be known as the Division of Senior Services or something like that, but it's the office on a county level which is designed to assist seniors with getting them the resources that they need. A lot, not all, but a lot of these offices have benefit counseling available. This is a case of where trained volunteers will actually sit down with you and help you with these types of questions. So it may or may not be available in your area, but this is definitely something that you can use to get that second opinion, because quite frankly, you don't want to be just relying on the salesperson's advice. So I want to put this out there. In addition, I don't have it on the slide here, but if you feel that it's necessary for you to contact a competent elder law attorney, by all means, that's something to make sure that you make the right decision. All right, so I hope this helped to give you some ideas. This is Tony with Stuff Seniors Need, and I will see you next time. Take care.